Hello, my topic today is about Alzheimer's disease. Think about not being able to remember your family, or performing normal everyday tasks, or progressively just worsening over time and not being able to stop it. Alzheimer's disease is closely related to dementia and causes problems with memory, thinking, and behavior. My personal family experiences with misdiagnosis of Alzheimer's and dementia have led me to investigate further into this topic. I would like to talk to you about today the symptoms of Alzheimer's disease, the risk factors of the disease, the stages, and the treatments of Alzheimer's. First, let's take a look into the symptoms of Alzheimer's disease. There are about 10 symptoms. We're going to touch on 3 of them today. The 3 main ones I pulled directly from the Alzheimer's Association website. The 3 of them are memory loss, challenges in planning or solving problems, and difficulty completing familiar tasks at home, at work, or at leisure. Memory loss, typically they are important dates and you tend to rely on memory aids at that point. Challenges in planning or solving problems, they can't follow a plan. It's really hard to work with numbers at that point, and their concentration is not there. Difficulty completing familiar tasks at home, at work, or at leisure. Some of those include driving and managing certain budgets, whether it be at work or at home. Now that we know the top 3 symptoms of Alzheimer's disease, let's take a look at the risk factors. There are a couple of risk factors that may increase your risks to getting Alzheimer's disease. The first one being your age. They see a significant jump as we increase in age. And today I have a chart for you to view. And as you can see on the chart, there are ages on the bottom. Basically what it's showing us is that ages 30 to 59, there is a very low chance, less than actually 2 per 100 population. 60 to 69, it grows. 70 to 79, it's it's almost 4, and then 80 to 89, it's actually almost 12. So it significantly increases after the age 80 typically. Family history is another significant issue with when they see Alzheimer's disease. It follows through with genetics. There are risk genes and deterministic genes that all play into part here. Now let's look into the stages of Alzheimer's. The stages there's 3 different stages: mild, moderate, and severe. Mild, you start to see they still function independently, but the memory loss is starting at this point, and they do have a difficulty performing tasks. In the moderate stage, this is the longest stage they actually see. It can last for several years actually. You start seeing them get moody, very forgetful, and there is a big change in sleep patterns. And then the most severe is the severe state. They require full-time assistance. They're very vulnerable to infections such as pneumonia, and they have difficulty communicating. This was also pulled right from the Alzheimer's Association's website. Though there's not a treatment yet that will cure and stop Alzheimer's and possibly reverse it, there are many other treatments available to help with the onset of Alzheimer's. Treatments include, really no treatments pulled from the National Institute of Neurological Disorders and Stroke. And then there are medications to treat symptoms. To treat the concentration issues, to treat the memory loss. Like I said, it does not cure it. It does not stop it. It will just help with it. Usually this only lasts for about a month to a couple of years at best that these treatments will last for. In summary, Alzheimer's is a disease of the brain that causes problems with memory, thinking, and behavior. It's not a normal part of aging. This came from the Basics of Alzheimer's Disease brochure. I have gone through today the symptoms of Alzheimer's disease, the risk factors of the disease, the stages, and the treatments. One day a cure will be found through the research conducted for Alzheimer's, and we can put a stop to this debilitating disease once and for all. I did ask a couple of questions in regards to the what you guys knew about Alzheimer's, and essentially people were very knowledgeable with Alzheimer's. Everyone knew that Alzheimer's was, in fact, related to dementia. A majority of the class is personally affected with Alzheimer's within their family. A lot of people said that it could be prevented, slowed, or cured. It really can't be, which is fine, not a big deal. And then most people thought 500 to 750,000 cases were seen per year of Alzheimer's as well. Thank you.